when it comes to rehab or talks of rehabilitation, the postgraduate interest will be a wee bit low compared to the other biological aspects of psychiatry and so on. So, but in terms of when it comes to IMH, when we start treating a patient, we go all the way. We try to go all the way with them. So that means if they are unemployed, we go with them till we find an employment. So how did that role change happen for us, in spite of all the huge work burden that IMH faces? And now, since Tamil Nadu also has released this Tamil Nadu state policy of homelessness, so I'm very happy here. So this is the next step. So first we'll get into this Mental Health Care Act 2017, wherein we are going to look into the definition of halfway home. It means a transitional living facility for persons with mental illness who are discharged as inpatient from a mental health establishment, but are not fully ready to live independently on their own or with the family. So, of the many conversations that I have here with Sivakumar sir, whom little bit is in conflict with our halfway home, when he always insists that it should be in the community, and we will tell you the story of it. It was in 2018 when almost 2019 March we had the lockdown and COVID, and we were also on the verge of a Supreme Court case. I think all over India, all the mental health establishments now are facing the burden of what are you going to do with people with mental illness. And the term they are using is they are languishing in your hospitals. They are languishing in your hospitals when they have so many community-placed establishments to go, and it looks as though that we were keeping them, which was not so. We were trying our very best, but at the same time, there was one aspect of it which was lacking. So even this picture is a very wonderful picture, which I really love, and I love to share it with you now. So this person who is going out of Institute of Mental Health is one of our resident. He is a resident of our inpatient unit earlier. Now he is working as a security guard. And it just happened. It was a coincidence that he happened to be in the pic when we clicked a pic of Institute of Mental Health. So no more perfect picture for this topic. So this was also came in just 2-3 days back, Hindu, where over 60% of the homeless are vulnerable women, children, and elderly in Chennai. And they also said that they belong to the Tenambat area and the Royapuram, and also mental illness played a very major part in people becoming homeless. And before we, as Sir was telling, to know about IMH, you first have to get an idea of what we are. So we are a 200-year-old institute situated in Kirpak. When we say Kirpak, is synonymous with IMH. IMH is Kirpak, Kirpak is IMH. So to the extent there is another hospital near the DME campus in Kirpak, it's known as Kirpak Medical College. But people do confuse ours with theirs. And our institute is such a huge institute that one side of the institute comes under Chennai 10, the other side goes to Ayanavaram in Chennai 3. And we have had doyens here. It was in the 18th century. It was known as the Dalton's Madhouse, the Lunatic Asylum, the Government Mental Hospital. Then if you can see the history itself will take hours to do. But since our experience of halfway home also matters, but even now we have this old mental health code book. When we go through it, we see that there were people admitted from Orissa, Karnataka, Andhra Pradesh. And Professor Dr. O.S. sir used to say that there was a time when patients were from foreigner patients, where they're just post-independence, that they were known to as non-Indians, and Indians also were marked to the case sheet. And children were admitted earlier, but now, right now we are not admitting children as per the Mental Health Care Act. That was before that. There was a children's ward, there was a leprosy ward, there was a tuberculosis ward, and there was an insulin coma treatment being given. Everything, you name it, Institute of Mental Health had it. It is a place of history. So from there, we have Dr. Sharda Maiden Madam, we have Professor Dr. O.S., we had Professor Dr. Peter Fernandez said. They were all doyens of this Industrial Therapeutic Center, which was run in which is still being run in Institute of Mental Health. And we used to hear stories. So I had the opportunity to interact with the madam, with Professor Dr. O.S. and Peter Fernandez sir still. And Sharda Menon madam used to say that she earlier used to go visit shops to ask them for orders on incense sticks, paper covers, and there used to be a lot of things that she said when she went into the female ward and when she saw the patients sitting there doing nothing, she had this thought, what? They should not be like this. They should go to work. So that's where the thought happened. And there was a time when we have a bakery running, which earlier used to supply bread to all of the hospitals in Chennai. But now, of course, it is being confined due to various, the progress and the human resources that we supply it to one or two hospitals. And along with it came employment. So what she did was she used to employ our long-term patients inside in those days in Institute of Mental Health for the bakery. And people were trained by Mahadevan sir, owner of Hot Breads and the chain of restaurants. He used to say, and when we opened our Revive Bakery, which I'll show you later, Sharda Menon madam had dropped in. It was a very coincidence that she dropped in on that day. So it was one of the most happiest moments we had. And before I go on to our experiences, when we look at articles, which the mental health supported accommodation services, these are one of the few articles which talk about the systematic review of it. And they say that the term itself is very, there is multiple terms. It is like 400 articles. They could find out 307 terms because everything is like gray area. Everything has got multiple names, the duration, the accommodation, the community integration. So there are a lot of things that play into it. And they did this study. This is one of the few papers which did a systematic review. So there is one article from India. When I tried to track that article, we were not able to see which one of it. I was also interested to know. So there were more than 115 papers which was taken from all over the world. And they brought it into these three definitions like homelessness, deinstitutionalization, and general severe mental illness. So then for this, they did all these headings under supported accommodation, under housing stability, service use, and symptoms of mental illness. So they found that when the people are homeless, so getting them a home gives them housing stability. But apart from that, nothing much changes in terms of drug adherence, in terms of substance use. So, but there was no deterioration also. And if mental health services, there was one point that was given there. If the mental health services are integrated within, the homeless people were able to stay out of it and under a roof for quite a period of time. In the same way, deinstitutionalization, as you all know, there was a wave of deinstitutionalization post 1980s and all over the world. And even whenever someone comes in and says Institute of Mental Health is a kapagam or an asylum, we also say, no, we are not. But there are otherwise that we consider it as a long stay mental hospital. So they say it depends on the supported accommodation type, how much they stay out of homelessness. It could be a nursing home, it could be a supported, or it could be integrated within the community. And definitely the symptoms of mental illness improve as per this under this deinstitutionalization if they are in touch with the mental health services. And also this general severe mental illness also, the supported accommodation type, if it is a sheltered housing. Here itself, you can see me telling a lot of names. So this was also one of the reasons where even though we have a lot of articles, the results and the findings that we could get from it, I think as sir said, can talk from our experience alone. And in the same way, the social functioning also does not differ much in terms of homelessness, and they remain socially isolated. And employment, in deinstitutionalization, there is a reduction in rate of unemployment in deinstitutionalized who maintain themselves well, who are there to drug treatment, and who are in contact with the mental health professionals. So this was one of the studies. So the supportive relationship, there are a lot of factors that were good, the case manager, the access to housing, the neighborhood quality. If you can see the Tamil Nadu state policy, what we had been released yesterday by our CM, talks of access to ration, which is one of the main things that will keep the patient sustainable. and in the long run. So there are a lot of disability benefits, and also a lot of departments have been roped in, like social welfare department, department of differently able, the corporation, the cooperative ration PDS shop. So there is a lot of departments which come into play a role in our policy yesterday, which has been released. And what works? So after this, we'll go quickly to our halfway home experiences. So this is also one of the article, if any postgraduates has logged in, which talks, since there is so many definitions, there's so many domains, this is one of the simplest one that can be done. So you can see the housing characteristic, the geographic proximity to mental health services, the lease, the structure, everything plays a role. The staffing location, the intensity of support, which I will talk about IMH. And this is one of the simplest one that they give. And this article is also being quoted in a lot of other articles to the simple taxonomy which can be done. So here comes our experiment in IMH. So this was earlier to a halfway home. Just prior to COVID, we had a Better Chances NGO, which was run by Porkudi. So she said she earlier had a stint with Banyan too. She gets houses in the mid of the community, and the house owners, here the client is standing with the house owner who has some 5 or 6 houses, and the NGO goes and has a talk with them, saying about the support that we would give in any case if there is any problem, and that the continuous visit they'll be doing with the client, and the client, he was in a job in DMS Tenambet. So they agreed, and one of the happy days wherein we all are there, the blue check shirt is Dr. Venkatesh Kumar, and that's me. So this is that housewarming ceremony we went. But unfortunately, what happened was 2019, COVID stuck, and he lost his job, and he was not able to pay the rent. So at that time, the halfway home was not operating. So we had to shift him back to the ward. And also one relapse he had, which was picked up by the NGO who visited, and that time he was again in the IP ward. And this is one of the other things that you all know in all the other states also. This is an emergency care and recovery center concept, which is running in Tamil Nadu. So what do we do here is, it's a phase 1, phase 2, and phase 3. Now almost all the medical colleges will be having it. They pick up the person with the help of NGO. If they find any wandering mentally ill person, they pick them up along with the NGO. A police memo is put, and then they will be taken to the center, wherein they will be treated there with all these personnel along, taking care of them. And once they are recovered, if they are able to find their addresses, they will be sent to their addresses. And if they are able to track the relatives, if any friends, anyone, they'll be rehabilitated. And if not, they will be sent to homes. So homes, which is run with differently able department, if the person is intellectually disabled, if the person is mentally ill. And herein I have to specifically say about Shraddha. Shraddha is run by Bharat Wadhwani sir, with whom we have a close correlation. Almost every one of these ECRCs he has visited. The Shraddha team has visited, and they have done an excellent job, not only in all the ECRCs, and we consider Institute of Mental Health as one of the biggest ECRC, which has been running for many years prior. Before, the smaller ECRCs has been there in all over the district, in all the districts. So for the entire Tamil Nadu, the ECRC will be Institute of Mental Health, is what we keep saying. And Shraddha has taken people from clients, improved patients from IMH to Assam, Chandigarh, Orissa. Even in one conference, a sir had said that one of the female patients happened to be a mother of a doctor. So there were such nice stories where we can, we are happy that we are doing this job. And here comes a halfway home, which was established in 2022. That was in 2018 when I took over as director in charge, and the Supreme Court cases were there, and COVID was going in full swing. And if you can see the client, the profile of picture of our Institute of Mental Health is, we have acute patients. We have acute patients who are admitted with their family members. And also we have long-standing patients whom we have a separate campus on the IP, inpatient campus. And along with it, We have the ITC, the bakery, everything is running in the inpatient campus. And in this outpatient campus, we had we laid the brick for the halfway home. So it was like in 2022, CM inaugurated this, and you can see there are 14 rooms. So each room will have this is the outer view of the halfway home. So each room can have 2 clients, and there is a kitchen room also adjoining to it. They can, and this is one of their rooms taken earlier. So these are the profile of patients attending. Then you will get an idea as to whom we are admitting in in the halfway home. And for all the questions as to why it was not in the community, we consider it as so that since this is a place where public come and go, and most of the time we find that the coordination was easier, was one of the reasons that we thought of halfway home in the premises of the outpatient department of NGO. We didn't even think of it in the inpatient department, even though earlier there some discussions and conversations are going on about starting one in the Institute of Mental Health IP, that is in the long-term ward, with the doorway being on the road. But then also we still said, as per this thing, let us shift it here. So these are the profile of patients who are admitting IMH. They are brought by family members. Then sometimes people do walk in and say, I'm feeling suicidal, please admit me. Sometimes people walk in and say, since I'm mentally ill, I don't have any place to go. So please, I don't have drugs. And there might be symptomatic also. And sometimes brought by police. And the rest of the work of what we do legal certificates and HLD, learning disability. These are the other jobs that we are doing. And who has shifted to halfway homes is patients are improved, but with no social support. And patients who are improved but unable to trace family member, it could be due to wrong address or phone number, and family is not willing to take them back. In the sense, we have had stories of patients ending up in our gates after we have sent them recovered. And at times, due to the memories and the trauma which they had faced when they were brought for admission, and maybe due to the other factors, and delusion could also be a part of it, and the way they were treated, they themselves do not want to go home. They say, we will stay here and work. We will stay here and work. And we noticed this pattern of work and work and work that was in the conversations which we had with the patients. And at that time, in the outpatient department itself, we also had a Revive bakery, which was opened by our health minister, wherein the clients who did not want to go back home and who were willing to work were placed. Earlier, they were going to a distant place, I mean in near Adayar, wherein there were no transport during the COVID time. And that is one of the reasons that we found it easier to accommodate the patient, the role change that we gave. So one patient will be helpful in cooking. So he'll be sent to a canteen where they need a cook. And at times they might be, as a waiter, we will shift them back here. So that was a little bit easier. So these are also the wards that we have. The male, female in the halfway homes, and the inpatient block, we have the male wards, female wards. We also have a daycare center, which is in coordination with Tidal Park. Therein, we receive patients from even other centers, other organizations, and we train them in jute bags, in coconut shells, and we are also in the process of Erica net plate. So that is also there. We have been funded for another 3 year, but we are waiting for the break for the fund transfer. And what about the profile of the persons whom we have shifted into halfway home? If you see that person, the first client, his family was not willing to take him home. And what will happen is, we have, as I said, if you remember that we have inpatient where we have around 600 patients. So there are patients who these patients, it's a revolving door. Some of them go back if it's a bipolar mood disorder with a manic episode. They are here for 1 month or 2 months. Then once they get better, the family comes and takes them and they go. There are some who they don't come and we are not able to fit in. And the units, we have 5 units in Institute of Mental Health, and unit psychiatrist, the medical officer, someone who has seen them, and the social worker and the staff nurse. And when they find this patient improved and he wants to go to work, we tell them that there is this option of the way in which we tell them is there is a hostel here. If you want, we will place you in this hostel. You see how you like it. And after that, you can find work and then you can update us. So the moment they see the rooms, the moment they see the independence that they get, they never want to come back to the IP ward and they stay there and they say, we will find a job. So now then what happens is in their life, if they find a job, if they start going and the jobs also, we coordinate with Mahadevan sir, we coordinate with other persons who are willing to give them jobs. And if suppose there is a problem and the morning, the breakfast is like, yes, two clients will stay together and we don't put two new clients together. So one of them will be an earlier occupant and they are very familiar with the routine. So what will be the routine is just adjacent to the halfway home, they have a separate entrance for the acute ward. So there the breakfast will be given, but it's free. Either they can take it from our ward or we have something called Amma Unavagam, which is run at a low price rate and they themselves can go and buy it from there or the hotels. And then when they get a job, earlier, if suppose the first month's pay is not there, they don't have a pay, we provide them with the bus passes. Somehow we get them with the funds we have, the bus passes. And initially they will try to go for work alone or with other home residents. And of course, if they have 3-time medications, what they will do is they will get the medications from the morning from the ward. In the afternoon and evening, they will take it in a small box along with them to the workplace. And then they return back to halfway home around 7 or 8 in the night. At that time, the dinner will be there in the ward. They can have it or else in the nearby hotel. And if suppose they are not going to return back home, they want from there, they want to go to their family, see them and come back. Once they start working, the scene of change that I see is the family becomes responsive to them. In their family's eyes, once they see them working, they are very happy and they don't want to take them home. There is some place wherein he is working, he's earning for himself and he's happy and they don't get the problem. And we also see a change in the client's way in such that we have to advise them to think and invest wisely. They give away all the money every month to the family. When they visit the family, they give the money and they have only a few pennies on them for their own tea or coffee or the rest of it. And what happens when they relapse? So when they relapse, how will we know that they have relapsed? Either we get a complaint from the employer saying this person is very aggressive, he's very inappropriate behavior with the client or the customer. So once they come, we tell them that why don't you be with the observation in us? The 19 and 20 is the male acute ward and the female acute wards. No, we don't shift them immediately to the long-term ward. We keep them, and if they are very aggressive, we shift them to the IP is the inpatient ward. So there they stay for a week or two. Once they get okay, they are back to halfway home under supervision. And there are certain lessons that we learn from this halfway home. Almost everyone in Institute of Mental Health, we look at it as a means of freedom, of independence, to the extent that there are times when we think before placing the improved patients in halfway home, thinking what if they go away. Then I tell our assistants that it's okay, if they want to go away, let them, they are improved. And of course, this residents with antisocial personality traits is someone in our unit. I head second unit. All the assistants are everyone are familiar with. We have a client whom we have still an ongoing problem. So he had alcohol dependence and he also had in the halfway home, he was seen abusing alcohol. He created a lot of problems with the other inmates and also with the other clients and also with the ward staff, and no one could get along with him. And we started getting complaints from his employer and no job he could sustain. He'll keep on switching the jobs, and there were cases against him that he was handling cash, that he robbed, cheated. So with that in mind, we said that maybe you can stay outside and go for a job. And that is one person whom we have difficulty. And then comes medication adherence. They give a lot of reasons for not adhering to medication. They say that we have to leave early. Then we say you take that, or else we try to shift all the medication to the night, the afternoon medication. So every acute ward, the staff nurse will be having a list. The male acute ward staff will having a list of the male residents, and the female ward acute ward staff will be having the female residents of halfway home list. So if suppose someone doesn't come after 2 days, then if they are not replying, then we have a dedicated staff nurse whom pick I'll share later. She calls up the uh, uh, corresponding unit assistant and tells them that these persons have not come for drug, and she on their night duty will talk with them and make sure that they are continuing the medication. We warn them and tell them to that the medication only is helping them to go to job. And then substance use is even the articles studies say that the substance use is always there, but when it goes beyond a means, sometimes even persons who don't have become a dependent person. So we don't encourage it, and we tell them to get treated for it. And then comes absenteeism from work. Absenteeism, what happens is the notorious thing, the other thing that we have noted in a halfway home is they absent themselves from job. They just don't want to go to job. Then how do we find out? Where we have to go and talk with them. So when I'm in the OP, it's just a 5-minute walk from there. So when we try to bring them to the OP and have a talk with them, they know the timings when we will be there. So they are not found in the hospital premises itself. They'll go out and they'll come back late in the night. And the return hours also has been a challenge for us, because we find that after 10 p.m. it becomes little bit, even though we have a security there, and we have a security who is a recovered patient who's a security there. And since he needs his night sleep, and also the males are in the down floor and the females are on the first floor. So we have a female crystal worker who sleeps in the first floor. So if suppose they return late, it becomes sort of a challenge for us. So all these are challenges which I have to thank Sivakumar sir for. I was thinking about this, and wrote. So then we could come up with this 10 challenges that we manage. This fourth one of money management of residents is what, as I told, they don't send, they give away all their money. I asked them, so did they invite you for Pongal? Did they invite you for Diwali? Did you go and celebrate it with them? Most of the time they won't, but they make sure to tell our client, our patient regarding the problems that they have, that our patients take it upon themselves to go and give the money or send it to someone else or GPay it and make sure that the money reaches them. And then comes the first one is employment. So finding the right employment to match it with the client is a big challenge and is a huge one. I'll tell you the story of one person whom I picked up when I was going for a meeting. He looked very lonely and he was lying on the path. We picked him up through an NGO. Then but the very surprising thing was he was very fluent in English. And then I learned that he had worked in Delhi as a manager, but ended up, there was one brother who was abroad who never came. And this, our client itself does not have his address, no parents, no. So he is here working in our contracts as a supervisor. And then he was posted later to one of the branches in Sivagandhi, whereas there he could not sustain it. He said that there was long working hours and everyone have a phone. Everyone has a phone. Our numbers are there with them. It will be our numbers, my number, staff nurse's number, the doctor's number. So they'll be having access to everyone. So they do tend to message their problems. They do tend to message that saying that I cannot sustain here. I'm finding it very difficult. Shall I come back? So we told him to come back and he came back here, and we have again fitted him to this another branch wherein he is able to go. And we have a operator. We have a phone operator of IMH is our recovered client, and he stays there. And that thing is challenges is like he is staying there for quite a long time. He's having a regular income. He can still move out, but there is this one hesitation in him in moving out. So that thing should be addressed. We have 2 or 3 with a stable income who are staying there. And of course, some say 6 months, some say 18 months. There is still that gray area. And as for the human resources, we don't have an entire team of social workers. We don't have an entire team of staff nurses round the clock to monitor them. None. It is up to an interested staff nurse, and we have a social worker, and the respective unit takes charge of them. If there is any complaints about them, if there is any concerns about them, it will be addressed by that concerned unit. And somehow or other, since we are there for a long time, it will reach us, and we also try to coordinate. And this infrastructure, uh, most of the time we have to be a little bit strict in saying that this is not allowed, this we cannot admit right now in here. There are people who bring him exclusively for stay in halfway home, which we do turn down. And involvement of family, as I was telling earlier, most of the time they are happy to stay away and enjoy the monetary benefits. And the security, yes, as I said, security, there is only one security who stays there in a night. And the coordination between personnel, that is in terms of drug distribution, in terms of coordination regarding getting their UDID, getting their Aadhaar card. At times, what happens is they would have had an Aadhaar card, but once they are admitted here, the family would have shut them down. They are not willing to even send their Aadhaar card. So we have to get a new Aadhaar. So everything is a huge process here. And yes, the ninth one is the frequent change of job. That happens, and we find it difficult, the break in between. And the drug adherence, I've told you how we manage it. And the relationship, I've specifically left it, and I'll tell you later. And this is, it's around 62% we have taken it, and thanks to sir, after that only we sat and we took all the files and we were seeing who all were there, how many days they were there. You can see that more than 3 years, 22%. And at times, if you can see that 1 week and 1 week, I'll tell you, these are the persons who they feel that they are, that they abscond. They just walk away and say that we don't want to, they don't want here, and they end up homeless. They might be later picked up by an NGO and brought to us. Most of them are males here. And the employment, if you can see, the services in IMH itself is 33%. So we have a barber, who's an improved client. We have a phone operator. We have a crystal security. We have, then also we have them working in the bakery of our Institute of Mental Health. And we try to fit in, we try to look at our patient's profile if they are willing to, and at times without being fully employed, they can help in our getting our case sheets typed and all. And that sports is something that it's new. We started it in, we have a very interesting dental doctor come, very interested in sports. She was a force behind it. She is now entirely becoming the sports coach and sports trainer along with the Jayalakshmi staff. We have won a lot of medals. We have gone up to district level. And so that itself, I find there's a vast difference when they bring in irritable, and once they get into sports, they just want to win medals and enjoy the comforts, traveling. That's quite another separate talk altogether. And of course, NGOs, we have better chances NGO. We send them to Mahadevan sir in corporates. And there is another NGO where they go and work as security guard along with the Thagam Foundation. So there are a lot of people. Of course, there is a small percentage which is unemployed. So you can see that Writers Winners Cafe is with corporation. DPI canteen is in the education department canteen. There is another hot breads, 10 of them are working. Writers Cafe is quite a famous outlet, which is again by hot breads. It's near Satyam Theatre, Roypeta, and there are a lot of branches there. So we have placed all our personnel, all our record patient in the various branches. And services in IMH, the persons who are working here, as I said, we have a barber, we have a painter, we have a telephone operator, housekeeping we have, and we have a billing operator, and they're working as a staff, was trained here in some contract basis. And a working patient is 1. Marital status, unmarried is 85, married is 15% when they get admitted. And this is the profile of those patients who are here more than 2 weeks. The total number is only 2. And both discharged. In 1 week, sometimes the family comes and they take them back. Sometimes they themselves walk away. The discharge is sometimes they abscond, and sometimes they relapse and they are transferred to IP. And more than 2 to 3 years, as I said, these are the person who are working in Tenapet, who are working in the bakery and working in IMH, a very stable, nice job. And this is more than 3 years. And the two people passed away is one of them died due to a CKD. She was a very senior client of our Madras Bakery, Revive Bakery. And another person had a collapse and he passed away due to MI. He was also working outside. And as I didn't touch on relationship, this is the relationship that we have to talk on. These both of them were staying in Institute of Mental Health halfway home, and they were working in the Tidal Daycare project. Slowly, they fell in love, and it was a story. It's all over the net. We had media celebrating the people, and even now, when people see us, they say, "Are they here? Are they working? How are they?" And on the first year of their wedding anniversary, there were a lot of queries as to why, how are they? So we were supported so much. You can see our health minister, you can see our Hindu endowment minister, our MP, and everyone came and everyone was, our MLAs here, everyone was like happy, and the wedding gifts and wedding feast, and it was their own wedding. It was our own wedding. And it is all over the media. Hence, I told them that I'm talking about them. They're very happy. And my view on marriage itself changed after seeing them. It is almost 2 to 3 years. They do work here. And at times when one of the partners have a relapse, the other partner looks after them. And they're now staying in a separate rental accommodation outside IMH. So it was hugely covered. And yes, this is the Revive Cafe. That building is a police station that came up in our premises. So this is a Revive Cafe. It was opened by I was searching for photos in the last minute since I lost my phone. I couldn't get Dr. Sharda Menon Madam visiting our Revive Cafe. The yellow building behind Revive Cafe is the acute ward or female ward. And this left side will be our male wards. So you can see our patients here. The person who was sitting there, that she passed away. She was Chitra, she passed away. The person who's standing there is the supervisor who's working and is currently here in this branch only. We also have persons from others also working in this cafe. It is like acid burn victim survivors, then differently able to send people here to work along with us. And there are other halfway homes in Tamil Nadu, Madurai, Ramanathapuram, Tiruchirappalli, Kanyakumari, and Vettur. But of course, the way in which we function is entirely different from the way the other districts function. Here, it is like as we say, we never lock it. We lock it after 10 p.m. in the night and we open it. It's just for the safety. Rest of the time, it is free. It is like a hostel. I tell them, all of the doctors tell them it's a hostel. So the independence, the employment opportunities that are given to them, the freedom and the happiness that they get when they go out is, as I said, you can see that patient who was walking out from Institute of Mental Health. Sometimes we do start our experiments in such a way that we train them so that when they go to work from IP, that is from the inpatient ward, and slowly when they are steady and they are gone for a month or so, then we tell them there is a hostel if you would like to go and see and stay there. So this is one personal, you can see that 1 week they left he is a Sanskrit gold medalist. I knew him from 2010, even though the IPOP number says it's from 2024. He has an elderly father. He had some schizo-obsessive sleep disturbance. This is only for 2 years because this is from 24, but he has been there. We couldn't trace the old Akeshi. And he became homeless. See, you can see that from 2010. In 2022, he was brought by his friend who had visited saying that we have police memo. Then again, he was referred back and he was admitted in the inpatient unit. And then what happened, his father visited him and requested for discharge. And we sent him in 2022. But again, in 2025, he came back homeless. We found that his father has shifted to an old age home. He was living with his friend. And the friend brought him here. And even now, he's here. His messages are with me. He has sent a video to my WhatsApp because he was here with us on 11/2. Then again, he went away saying that he doesn't like to stay here. But again, his friend has called me and said he's there, ended up there. You'll bring him here. But this patient's request is each time he'll say, you place me in a halfway home and treat me there. you don't place me in acute ward itself. I don't like acute ward. But unfortunately, we have to place him in acute ward where the ward has other patients with their family members. So it's a mixed ward. But even then, he finds it very uncomfortable staying with us. So then comes, this is our staff, Jayalakshmi. I requested her photo to be sent so that I will post it here. It's her, she's on duty like 24/7. A very dedicated person, to the core. And these are the various references I looked up. And thank you. You can now bombard me with questions. And we also have a audio clipping of 2 of our recovered patients, which I'd like you to hear. So,
நண்பர்களும் நல்ல நிலையில இருக்காங்க. அவங்களும் வேலைக்கு போறாங்க. நல்ல மன மகிழ்ச்சியோட இருக்கோம். என் பேர் மோகன்குமார். நான் அந்த மனநல காப்பாத்துக்கு 2017 மருத்துவத்துக்கு வந்தேன். அதாவது மனநல பாதிக்கப்பட்டு இப்போ தற்போது நல்ல நிலையில் இருக்கேன். 2019 ஏப்ரல்ல என்ன திருமதி பூர்ண சந்திரிகா அவர்கள் அப்புறம் தான் டைரக்டர் வெளியில வேலைக்கு அனுப்புனாங்க. அதாவது டிஎம்எஸ் ஆஃபீஸ் அசிஸ்டண்டா இருக்கேன். இப்போ நான் தற்போது இடைநிலை பராமரிப்பு மையத்தில் இருக்கேன். அதாவது ஆஃபே ஹோம். நான் இப்போது எனக்கு வர்ற வருமானத்தில் என்னுடைய சொந்த தேவைகளை பூர்த்தி செஞ்சுக்கிட்டு மனமகிழ்ச்சியோட நல்ல நிலையில் இருக்கேன். மற்ற சக நண்பர்களும் நல்ல நிலையில் இருக்காங்க. அவங்களும் வேலைக்கு போகிறாங்க. நல்ல மனமகிழ்ச்சியோட இருக்கோம்.
So he is one who still doesn't want to leave after home. He wants to be with us. So we are not restrictive. We just keep telling him gently.
என் பெயர் முத்து. நான் அரசு மனநல காப்பகத்தில் பணியாளராக உள்ளேன். நான் 2 வருடமாக ஆப்பையில் தங்கியிருந்து 10,000 மாதம் சம்பாதித்து வருகிறேன். டெலிபோன் ஆபரேட்டராக பணிபுரிந்து வருகிறேன். என்னுடைய தேவைகளுக்கு வசதிக்கேற்ப செலவழித்து கொண்டு மீதியுள்ள பணத்தை சேமித்து வைத்துள்ளேன். நான் வெளியே சென்று வரவும் கொஞ்சம் எங்கேயும் போகவும் கொஞ்சம் அனுமதி இருந்ததால் மிகவும் சந்தோஷமா இருக்கிறேன். நானும் மட்டுமல்லாமல் என்னுடைய நண்பர்களும் மிகவும் சந்தோஷமாக உள்ளார்கள்.
This is Muthu. I'll tell an anecdote about him. He is so very improved patient, halfway home resident of IMH and our telephone operator. So he went to a petrol bunk nearby. So that time we had sent one of our usual patients to work there in the petrol bunk. That boy has not told that he's from IMH. So this Muthu alias telephone operator, he went there and told, no, இது எங்க patient ஆச்சே, அதை எப்படி நீங்க வச்சுப்பீங்க அப்படின்னு. He said, no, I was trying for better job opportunities for him and I didn't want to tell about it. Then I told him, please do not tell the third party of that he is a patient of IMH. So this is an anecdote about him, and this is about our revive. This is like our ex-health secretary Supriya Sahu ma'am has posted it on Insta. It was earlier posted by, it was open when we had Radhakrishnan sir as our health secretary. That also is a story. Radhakrishnan sir came and said, எங்கம்மா ஒரு கேண்டீன் இருக்கு, திறக்கணும்ன்றீங்களாமே, எங்க அந்த கேண்டீன் அப்படின்னு கேட்டாரு. So I said, sir, this is the place. So he was like, immediately he posted it in Insta. So there is it is an Insta. The beauty of the Revive Cafe. Those who are near Park in Chennai, please continue supporting it. Our clients are there. You can interact with them. And That's one of our dream. And moreover, Sharda Menon madam visiting it on the inauguration was icing on the cake.
I think the video was not playing, but we will share the Instagram link. So maybe people who are interested can just click it on chat, and then you can watch it. So it's actually video clip, but unfortunately, like here it is not playing. So we will just see.
And there is also always a gray area of who will run a halfway home, whether it is a social defense, or is it a differently disabled department, or is it the health department. So that also was there, discussed earlier, but we took it over. We took it over, and I think we are happy now seeing our clients going for job and coming. And any doubts you can ask me.
So I think we have people from different parts of the country who have actually joined. I think many are from rehab. So that is there. I think we also have people from Chellamuthu Trust, and then I think Chennai. I think from Shraddha also. See,
Bharat sir.
Dept Matthew is there. Yeah, Dr. Bharat Vatmani, of course, is there. So,
Nice, sir.
yeah, I think he has also posted the chat. Any queries?
Chellamuthu Trust also, they used to come and pick our improved patients for rehabilitation in Madurai. And they also have a Chungidi sari, which I was trying for my patients to get earlier. We were trying to get them trained in that, but we couldn't. As usual, COVID stuck. So thank you, CRS sir.
Is there anything else which people want to ask? Yeah, I think some comments which I had to tell was the concept. This is a residential facility. So a halfway home is a quarterway home is something which is there within the hospital. So technically, it is better called a quarterway home than a halfway home, because a halfway home will be outside in the community, which will facilitate different things. So that is one comment. I think Dr. Bharat Patmani wants to ask. So yes, sir. Maybe you can.
Yes. Yeah, can you hear me?
Yes, sir. Yes, sir.
Yeah, I was just wondering. See, we are collaborating with almost IMH Chennai as well as many of the ECRCs. Now, yes, all the ECRCs are placed in different places. Is it possible to bring all the patients together in a particular single shelter so that it eases the facility of travel? And maybe if it is in the north, Tamil Nadu, maybe we can do it with an ambulance also. Just a thought, because there are multiple ECRCs spread all over Tamil Nadu with whom we are collaborating. Whether it is possible to combine all of them together in a single shelter, all the patients, and then take it from there. So we know the number of tickets that we can.
Sir, I'll discuss it with our director now, Dr. Malepan sir, and I will update you, sir. I have your number.
Yeah.
So I will update you, sir. Maybe we can identify maybe Madurai and Chennai. We can identify one more and try to group them there.
Yes, because what will happen is that then if supposing it's a big, let's say 12 number or 15 number, we can directly send an ambulance and speed up the whole process.
Yes, sir. Yes, sir.
Yeah.
Definitely.
Otherwise, going individually to all the different ECRCs for the team becomes pretty hectic.
I understand, sir. Yes, sir. We'll address it, sir. Thanks a lot for coming online and giving your comments.
No, not at all. Not at all. You are a passionate person. You are one of the few rare passionate people in psychiatry. So you have to stay blessed and you have to stay strong and you have to continue for the next 50 years.
Oh my God. Thank you, sir.
Even Sivakumar is another one of those blessed people.
Thank you, sir.
So you have to continue, both of you have to continue for another 50 years, nothing less. 49 won't do.
Yes, sir. Thank you, sir. Thank you.
Yeah, for I think people who may not know, Dr. Bharat Vatmani started the Shraddha Foundation, and he has been working with organizations throughout the country, including, I think, one of the organizations with whom he has worked a lot is IMH Chennai, and they have helped in reintegrating many people across the country.
Maxase Award. Sir also won the Maxase Award for this rehabilitation efforts.
Yeah, and Raman Magsaysay Award is considered to be equivalent of the Nobel Prize for this domain. And interestingly, like you don't apply for it; they identify and give. So that is again something which is unique. And recently, I think he had the honor of the President of India inviting him for the Republic Day. Yeah, yeah. I think there is a query from this Tanushri Mishra. Yeah, I'm not aware of Association of Halfway Homes, but I think Nimhans is building a directory. I think it's called RA. So it contains all the facilities related to like mental health establishments in the country. So maybe you can go to the Nimhans website and then search for RAAH. This is for Ms. Tanushri. I think Dr. Varalakshmi, ma'am, can you, I think you can just switch on your video. Yeah. So yes, ma'am. No, we have to give permission for. Yeah. Yes, ma'am. Please speak.
Good afternoon, ma'am. I'm Dr. Radhakshmi. I'm an alumni of IMH. Very eager to listen to you, ma'am. And I've been working in ECRC for since till 2020, 22. For past 2 years, almost 20 to 22, I've been working in ECRC. As sir pointed out, that difficulty in mobilizing patients from each ECRC, there'll be always a delay. Patients will be recovered, and we'll be waiting for the ECRC team to come to us to take the patients, and they'll be asking us, can you send the patients to Chennai? From there we can take them, but we have only one social worker, so it'll be difficult for us to run the show for the daily activities and send one social worker to patient, drop the patients there. Sometimes we had our patients, social worker travel till Mumbai to leave our patients. So maybe as you say, working from Chennai and working in other districts CCRC are totally different, and we have the peripheral districts have certain challenges. Though I'm not working at present, I am representing on those behalf. Maybe as sir said, grouping of there is maybe a shelter at one common place, as you said in Chennai and Madurai. I worked in Viluppuram, so we can have a short stay in Chennai for those patients, and they can arrange for all the train travel, all those things. And one more thing, we are not able to know the follow up of those patients where we left their patients. So sometimes you'd be thinking what happened to those patients after 6 months or 1 year when we see the case sheets, old patients and all. So that facility also maybe we can think of getting some follow up details of those patients who left our ECRCs. So these are the two things I wish to highlight here. Thank you so much for the opportunity, and it was like a virtual tour of IMH. Thank you so much, ma'am.
Thanks a lot. Nice seeing you. Actually, I think Shraddha does a wonderful job in updating us. They send us photographs with reunion along with a mail saying where which part of the district, which part of India they have left the patient. Actually, the follow-up is required wherein our team goes and leaves it, and after that they don't come for follow-up to the nearby hospitals. We write to attend the nearby district psychiatric hospital for further follow-up. That follow-up only is lacking. So that probably we can follow up and say later.
Sure, ma'am. Sure, we'll try to. Okay.
Yes, thank you.
Thank you, ma'am. Thank you.
How, Dr. Swarali Konvilkar is, how do you manage tobacco use among the residential employed patient? Is substance use itself, thanks a lot, ma'am. Substance use itself is a huge task on us. It's a concern. So we have our.
I think Swarali works with Dr. Bharat Vatmani.
So
Swarali, are you there? Can you switch on your video? Yeah, just a minute, Ali. Yeah, you can. Yeah, please.
Yeah.
You
Yes,
are
sir.
still Vatmani?
Yes, definitely. Yes, sir.
Please ask.
So we also have a lot of residential recovered patients who work with us. So we face tobacco use as a major hurdle in terms of their recovery and keeping them tobacco free, or as much as keeping it less as much as possible. It's very difficult, especially tobacco. And regarding the how the salaries and the stipend because it becomes difficult for them to sustain the job, especially the fluctuations of the symptoms make the working capacity very fluctuating. So that may sometimes affect the productivity and outcome of the job that they're doing. And the employer might also feel that the payment, it might also affect the payment that they may get. So how do you manage these issues and these challenges?
So tobacco use among the residential employed patients is a concern. We even have alcohol on the premises of the hostel. But since we have a recovered patient there working as a security, who has this in-house stories will get to us, and we do immediately raid and say that we should not be doing it, and we treat them. And we treat them immediately. And we admit them and de-addiction, detoxification for alcohol itself. And tobacco also, we continue treating them and we tell them. And how do you decide on honorarium, salaries, and stipend is we have a contract as a certain limit. So that limit has been given to them for IMH patients. For rest of them who go to work with an NGO, NGO decides on it. And what suggestions do we give from investments here? I forgot we are in coordination earlier with Disability Alliance Vaishnavi. She was the one who came and started all this process of voting and also this investment process, the accounts and all. Because there were certain banks which were refusing to open accounts. So Vandana is one of the co-founder of Banyan. Now she is separate and she is working for Disability Alliance. And so right now, after that, she started it and now we have taken over. We give them post office accounts. We give them bank RD or FD. So we telling them not to send all the money to a family, which invariably they do. Invariably. But
Very
even
and gullible.
conversation. Even yesterday, I called our supervisor Srinivasan and told him, please have some money with you.
Yes, ma'am. Thank you so much, ma'am.
Thank you.
And I think Mr. Alphonse, who is Secretary of Medico Pastoral Association, I think the oldest NGO for mental illness, persons with mental illness. I think he has also typed that it is interesting to hear this positive talk about quite a bit of success, especially with employment. Yeah, maybe to just add on, I think the concept of residential facilities, everything depends on where it is situated and what is the philosophy of that particular place. There are places like which run like long stay kind of facilities. So, and there are facilities where NGOs run it and the family members actually pay it. What makes this residential accommodation at IMH Chennai unique is that like it is run by the government, one. Second is that like nearly all people who stay there are people without family support, where the family is actively involved. And the third part is that unless they show an inclination to work, so otherwise they are sent back to the closed work. So there is an incentive for people that if you show drive and you come out and then work, then you can stay here. So that is maybe the price which they get for independence in that sense, and then autonomy. So I think the system is built in, and if someone is not working regularly and they are found doing other things, then the person has to go back and lose that kind of privilege. I think this is the key part which actually makes it tick. There are challenges everywhere, including in halfway home, especially because the key thing is like, does it come under Ministry of Health or Social Justice? So who is going to fund it? And then when it comes to social justice, invariably like we do not have expertise, and then there are a certain familiar excuses which are given. So as things stand as of now, there can be a debate of whether this is the ideal place to have a halfway home. Yeah, but you can call it whatever you want. But the thing is that it meets the need of a few people who are young, who have the drive to do something in life, and it gives an opportunity exactly for them. And people have a way forward. And I think the marriage, I think wedding between two people, I'm not sure if this was done in any other government hospital. anywhere in the country. So this is something which I can tell. So I think some of these things come when you see the human being in the other person, and do not reduce them to the medical diagnosis to whom medications have to be given and tests have to be performed. Because when that is there, everything else follows. I think that is the thing. I think Dr. Bharat Vatmani has asked, okay, the capacity.
14 rooms for male and 15 rooms for female. 50. It's Nimhans.
50. We will discuss it later, sir. So that's it. So I think thanks for the participation, because like madam is also I have taken as it my responsibility that she will board the train. So thank you very much. I think we have had nearly 40 people. I think some left in between. So thank you for the participation. So once the recording etc. is available, we will post it on YouTube and also share it for public viewing. Thank you very much.
Thank you. Thanks a lot. Thank you.